Hey y'all, welcome back. I'm so glad you're joining me for another round in our acid-base adventure. Today, I'm breaking down a topic every nurse needs to master: respiratory alkalosis. Let's start with the basics. Respiratory alkalosis happens when the body's losing too much carbon dioxide, making things a little too alkaline. That usually means there's a drop in carbonic acid and hydrogen ions floating around. The classic culprit? Hyperventilation. But don't forget, fever, anxiety, pain, or even too much ventilator support can send your patient into this imbalance. Now, as a nurse, spotting the signs early makes all the difference. So, what should you be watching for? In the heart, you might see a fast pulse, low blood pressure, or even some sketchy rhythms. Neuromuscular-wise, think twitchy muscles, numbness or tingling in the fingers and toes, or, if things really ramp up, seizures. Neurologically, your patient might feel lightheaded, dizzy, or have trouble thinking straight. And don't ignore those tummy troubles like nausea and vomiting. The respiratory side is a bit sneaky. Sometimes you'll notice your patient compensating with slower, shallower breaths. But if their lungs can't keep up, hyperventilation might keep going strong. So what's your nursing game plan? First, monitor. Pay attention to their breathing and watch for distress. Provide calm reassurance and teach them breathing techniques. Sometimes just slowing them down and encouraging deep, controlled breaths works wonders. You may need to grab a paper bag or a rebreathing mask to help them take back a little carbon dioxide. And for anyone on a ventilator, double-check those settings. Don't let them overdo it. If your patient starts to show tetany, calcium gluconate might be in your toolkit, so be ready if the provider orders it. All right. That's a wrap on respiratory alkalosis. I hope you feel more confident spotting and managing this acid-base issue. If you learned something new, hit that like button, subscribe, and share this video with your fellow nursing students. Until next time, keep learning and take care out there.